Hello and welcome to MSK Unknown Case 85. Here we have a frontal view of the shoulder. And the high yield question is, what is the most likely underlying etiology for the finding seen? Is it trauma, metabolic, congenital, or vascular? What's the most likely underlying etiology for the finding seen? If we take a look, the humeral head is articulating normally and well with the glenoid process of the scapula. However, there is a defect here along the lateral aspect of the humeral head, reminiscent of what a Hill-Sachs lesion would look like from a prior anterior glenohumeral joint dislocation. And also the inferior glenoid here looks a little ill-defined and irregular, suggesting there may have been trauma here and possibly a Bankcard lesion or injury to the anterior inferior labrum and possibly the bone. So this is likely sequela of prior anterior glenohumeral joint dislocation, which of course happens from trauma, the majority of cases. So the best answer here would be A, and this would be trauma. And we can see the Hill-Sachs defect here along the posterior lateral humeral head. And we can also see that there is some element of likely an osseous Bankcard lesion with osseous irregularity along the inferior glenoid here. So this is likely related to prior trauma. And now an anterior shoulder dislocation is the most common type of shoulder dislocation. You can have a posterior dislocation, you can have an inferior dislocation, but really 90 to 95% of all shoulder dislocations are anterior. We see this, actually, I probably see this on a weekly basis. I may see a posterior dislocation on a seasonal basis, maybe 3 or 4 times a year. And these are usually traumatic. They usually occur when there's been a direct blow to the back of the shoulder, maybe the anterior arm, and the arm is usually in an Aber position, an abduction external rotation, as you sort of see here in this cartoon. Now, an anterior dislocation on radiography, this humeral head, which you see right here, moves inferior medially. That's what it's going to look like in an anterior dislocation, in an acute anterior dislocation. It's not articulating with a glenoid anymore. And the Hill-Sachs, so if we take a look here, this is the glenoid process of the scapula. This here is the anterior labrum. This here is the posterior labrum. This is the humeral head, okay? And what happens is in a Hill-Sachs lesion, the posterior lateral aspect of the humerus impacts along the anterior inferior glenoid. So this red area here is the Hill-Sachs lesion or the defect along the posterior lateral humeral head, and this labrum has been torn and stripped, and that is the Bankcard lesion. Now, a Bankcard lesion can be purely labral, meaning that the labrum is torn, but the bone has not been broken, or there can be an osseous Bankcard where the bone and the labrum are both torn or broken. So Hill-Sachs lesions and Bankcard lesions are common orthopedic terms that you hear associated with anterior shoulder dislocations. I think it's also important to remember that 35% of fractures from dislocations only become visible on post-reduction films when they've manually reduced the shoulder and the shoulder is back in its anatomic location. Then we start to see fractures that we missed on the initial X-ray. Now, indications for shoulder dislocation surgery or recurrent instability typically revolve around the size of Hill-Sachs lesions and the size of Bankcard lesions. So if the Hill-Sachs lesion involves more than 40% of the circumference of the humeral head articular surface, that can be an indication that this patient is going to have recurrent dislocations and they may need surgery. The same is true for an osseous Bankcard lesion. If an osseous Bankcard involves more than 25% of the glenoid circumference, that could be indication that the patient is going to have recurrent dislocations, recurrent instability, and they likely need some surgical augmentation. So those are the indications really for surgery, especially in younger patients. Thank you so much for your attention. Tune in next week for another high yield MSK unknown case.